Subscribe to our YouTube channel and don't forget to press the bell icon to get all the latest updates.
Should India begin to consider easing the restrictions on the lockdown? The lockdown seems to have perhaps served its purpose in containing the spread or the scale of the pandemic. Kiran Shaw is one of those business leaders who's alluded to the positive effect of the lockdown and spoken of how there may be an opportunity now for us to look at a calibrated revival of economic activity and normal life. Kiran Shaw joins us now on the program. Kiran, pleasure as always. Tell us a little bit about the data that you've been studying. What is it pointing to? I know you've been looking at the numbers very carefully. You've also been asking for more testing, 100,000 tests a day at least. What is the data telling you at this point?
So the current data actually is just telling us that, our what they call the test positive ratio is actually is about 4.4% in India, which means that 1 out of 23 people that we are testing is positive. And we are also seeing that when it's compared to other parts of the world, these are very low numbers. Because just to give you some perspective, in the US, this number is almost 19.5%. In Spain, for instance, it's 18.3%. In Japan, it's double at 8.8%, and so on and so forth. So I really believe that India is in a good place when it comes to TPR. Though, of course, the one important thing is the TPR is only as good as the number of tests you perform. But having said that, actually, I think this number will be even better if you test more.
The more you test, there's a chance of finding more positive.
Yes, but also if you test much more, you are also likely to find if the same ratio is used, yes, it'll either improve or it'll stay the same. But more than anything else, Barkha, we need to remove this social stigma that's associated with infection rates. I'm not worried about the positive numbers. I'm more focused on the severity of the disease and the deaths. So if you then look at the number of deaths, we are very low. In fact, Asia and South Asia is extremely low when you compare it to Western populations. So I think that is a very, very good sign for us, because I have always believed that Asia and Asian populations are far more robust when it comes to dealing with this particular virus than Western populations for two reasons. One is that Western populations are aging populations, especially in Europe.
Right.
India's demographics are very favorable. More than 90% of our population is below the age of 60. That's a very, very positive demographic when you're trying to deal with such a pandemic. Secondly, you combine that with our exposure to zoonotic viruses. Even SARS is a coronavirus. But many other zoonotic viruses like swine flu and, all those other zoonotic viruses. And Asian populations are far more immune, therefore, to zoonotic viruses than Western populations are. And that's why you're seeing this very, very severe, impact on Western populations that this particular coronavirus has had. I would also like to say that science tells you that COVID-19 is less lethal than SARS and MERS. But the reason why SARS and MERS didn't become the pandemic of this scale was because of the fact that China in 2002 was not that connected with the world economy. And therefore, the number of flights in and out of China were few and far between. Today, you have 3 flights a day from Wuhan to Milan. You have flights from Wuhan to Tehran. And that's how the pandemic has started, because the epicenter in northern Italy and Iran happened because of the Chinese workers who went back over the Chinese New Year, got infected and brought back the infections to their workplaces and made it into epicenters.
So just so that we're completely clear about this, I know that you've advocated more testing. I know that it's quite clear that India has been a very positive outlier in this story in terms of the fatalities that we've seen. Could there be, and I'm just being cautious here, could it be that we are not at our peak, that we're far away, that the lockdown actually staggered everything, which is what it was meant to do, and therefore we simply don't know where we stand? Or would you say we can safely say India is not going to be Italy, France, Spain, America?
I would say the latter. And secondly, Barkha, on the 3rd of May, we would spend 5 weeks under lockdown. I think that's an adequate amount of time to test this hypothesis that we are in a safe place. Moreover, I continue to say that we are a population that's young, and therefore, if you look at it, the first important thing we need to do is to remove the social stigma associated with infection rates, which, as you know, is causing a huge amount of societal uh, misbehavior, such as, attacking those health workers and what have you, because a fear psychosis has set into our society, saying that anyone who tests positive runs the risk of death. I mean, that is ridiculous. The mortality rates are so low. I think proper information should be shared with the public at large. And I also believe that in India, if you see, most of the cases, 80 to 90% of the cases are actually moderate and even asymptomatic.
Yeah.
And it's very few. And if you look at the mortality rates, it is associated with comorbidity, age, etc., etc. So when we do open up, one of the things I want to emphasize is that we will need to put in place safeguards and surveillance. That is going to be very critical. And what do I mean by safeguards? Simple examples are temperature profiling and masks. Those are safeguards. The surveillance that we need is really to track and monitor outbreak in clusters. Those are important to seal off. But equally, I would say this overreaction to, finding a positive case has to stop.
Yeah.
In workplace, for instance, if there is a positive case, you should get them to quarantine without having to shut down the facilities. So I think this kind of understanding has to come about, saying that, look, there are going to be positive cases. There are going to be positive cases even in the workplace. But that doesn't mean the whole workplace has to shut down. You just need to pick up these positive cases and
put them in quarantine.
And as soon as they are okay, they can come back. And I think that's the way we will have to deal with this pandemic.
So let me ask you this, since the numbers look decent, they give us some optimism, and as you said, 5 weeks is a long time to be in lockdown. Would you then say that on the 3rd of May, it is time to lift the lockdown, at least zonally? At least zonally, we should be lifting the lockdown, because Kerala, for example, did want to lift the lockdown and the center was not comfortable. They were ready to lift many more restrictions than the federal government was comfortable. Where do you stand on this? People like Rajiv Bajaj have been arguing, create zones, let us get back to normal. Would you agree with that? Would you say 3rd May, lift it?
So right from the beginning, we have been saying that there should be a calibrated lifting based on the zoning. And we've talked about red, amber, green zoning based on, the number of cases, whether they're on the rise, how many new cases per day. And there are many green zones, fortunately, in rural hinterland of this country. And those should be allowed to operate as normal. But I also believe the amber zones also can operate as normal with a lot of surveillance. It is the red zones that need to be sort of sealed off, watched, and until you don't see any more cases, then you can let them into the amber zone. And I think this has been very successfully demonstrated. I mean, Kerala itself has demonstrated this. That Kolivada in Worli itself has demonstrated it, which, in stark contrast to Dharavi, Kolivada has been very successful because of this strict isolation. So I think there are ways of doing it. But we must also remember that we will see positive cases, but we will slowly get used to the fact that testing positive is not a doomsday kind of,
That's very important. The other thing that's very important is, because testing positive is not doomsday, companies should not feel the liability of what will happen if one of my employees tests positive. Now, today, the government has clarified that there's not going to be a 7-year punishment, etc. But the employers are still going to be held liable if there has been negligence, if they have been cognizant. Now, these are vague words, and I think they might scare a lot of employers.
Yeah. So I think, again, there needs to be a strong effort to destigmatize this disease. And I think that's what we need to really focus on, I feel, as a very important aspect of dealing with this pandemic. Because if we don't destigmatize this disease, I think there's going to be a paranoia in society which will prevent us from bringing back our lives to normalcy. So I think that's a very important focus that everyone needs to have, which is to remove the stigma. And I personally believe we have enough data to show that we are not at risk. We are not at that high risk that everyone thinks we are at. I mean, let's not extrapolate from Italy and Spain and US, because they have mismanaged the whole pandemic. You know, one thing I want to tell you, Barkha, which is that in 2002, when the SARS pandemic happened, it affected something like 17 countries around the world, but mostly in Asia. Only Toronto and London were the outliers when it came to non-Asian centers. Now, because it got contained very fast, I mean, there was 10% fatality. Please remember, there were 8,000 people who tested positive and almost 800 people died. So it was like a very fatal, lethal virus. In fact, it's considered to be more lethal than COVID-19.
Yeah.
Now, just because it got contained, because as I mentioned to you, 2002 was a time when the world was not that connected, you know. And also we used the same methods of isolation. Flights from China were stopped, but as I told you, there were very few flights. So the only Chinese who came out of China really infected Asian countries. A few Chinese who went to Toronto and London probably infected a few people there. But very quickly, once they realized what it was, they isolated, they quarantined, they contained, and very soon the spread was over. And the biggest travesty that we have committed to ourselves is that there was a vaccine under development at that time, which was stopped. Why? Because the vaccine, developers of the Western world felt, oh, this is an Asian disease, we don't need to do anything more.
Yeah.
I think we would have been in a much better place, Barkha, if we had a SARS vaccine and if we had all immunized ourselves against the SARS.
Yeah.
So that's what happens. Today, I think what has come out of this crisis is the world finally had a wake-up call. We had many alarm bells ringing in the past through all these zoonotic viruses which didn't spread the way it is happening today. But we didn't listen to it. Today, it's a rude wake-up call and we are trying to respond to it in a very ad hoc way. Some countries like India have done a very systematic response. I think India has done extremely well in terms of the rapid response we've had. We use this lockdown time to get ourselves into a state of preparedness. So there's a very good preparedness planning ongoing during this time. Crisis management has been a little weak because, we didn't foresee the immigrant workers and that exodus, which you have very nicely covered in many of your reports, and things like that. And of course, now we have to look at crisis management from the economic revival point of view. So whilst we've done rapid response, crisis management to a certain extent, and preparedness planning, we need to do the same with the economy now.
That's what I was going to ask you. What next? How do you reassure business at this point? FICCI, CIA have both a long list of a charter. They have clarifications. People are worried. They're worried about reverse migration. They're worried about the workers not coming back. They're worried about their liability. They're worried about suddenly being asked to deposit taxes in June. There are all kinds of things that are worrying business at this point. Kiran, what should be the priority for the government in terms of a fiscal package and in terms of making industry feel comfortable?
Yeah, so I think you raised all the right points. One thing is we have to remove the social stigma to begin with. We have to have very sensible quarantining kind of procedures and protocols for workplaces, because we cannot afford companies to think that if they find one positive case, they'll all be shut down, because then they won't be reporting. You see, that's another problem we have. We must report positive cases and quarantine them without feeling the angst of saying, oh my God, or the paranoia of feeling, oh God, I'm going to be shut down. Okay. And of course, none of these punitive measures of being jailed or, fined or whatever it is. Except that as an employer, you must make sure that you create a safe environment, that you have surveillance in place, that you have looked after your employees in the right way, that you must enforce mask wearing and all the rest of it. But I also believe that now when it comes to economic stimulus, there are a number of measures that you need to take. One is that we have willy-nilly got into a very new kind of economic environment, which is very dependent on services. Your groceries are delivered to your house. Everything is being delivered to your house. Now, I think I just heard Mukesh Ambani saying that with WhatsApp and Facebook now being part of Jio, they're actually creating Jio Mart, where they want the Kirana shops to actually provide the logistics and deliver things to home, which is great because that actually opens up a very new set of opportunities for these mom and pop stores. The other thing is, I think we must look at sector specific needs. I mean, there are some sectors which will take a very long time to revive. But in the meantime, can we look at sectors that really have promise? Like, for instance, let's look at the healthcare sector. I think there's a huge new opportunity for the healthcare sector, but we must also remember this is a capital intensive sector. So how are you going to provide capital to these companies for scaling up? For instance, today, I can tell you the world will need billions of vaccines going forward.
Yeah.
Not just the COVID vaccine, but every virus, because everyone will want to immunize themselves against pan-viral vaccines. So that's a big opportunity for India. Then you will have, the pharmaceutical companies, generics and biosimilars are going to be extremely important to contain healthcare costs. So there again, we need scale. Then you want to bring back a lot of that manufacturing to India from China in pharmaceuticals. So all that requires capital. How are you going to provide that capital? So there are 2-3 things we need to do. One is, can we relax the debt equity ratio, which is linked to these kind of investments? Instead of 2:1, can we make it 3:1? Yeah. And bring in that extra capital, but linked very clearly to the these kind of capex investments. And they are, of course, job creating as well. On the other hand, the government also can be very smart. They can say, okay, we will provide you equity by investing in your companies. And then they can have a return on equity when things turn around. That's another very interesting model we can think of.
Yeah.
The third thing that we should also be looking at is how do you, you must allow R&D to go on, because right now we've also seen very interesting things. Now, vaccines are being developed by Indian companies, okay? Startups. And these startups were actually starved of capital. They had no access to real money. Now with all this happening, everyone's interested in every single vaccine project. So some of these vaccine programs are very exciting, very innovative, very novel. But we've totally ignored our innovative quotient in this country. So I think the 250% weighted tax deduction for R&D must be reintroduced. Okay, I think that will make us again a very innovative country. And then, of course, you're also going to see a lot of VC funding and things coming in because of this kind of innovation need. Of course, healthcare itself is a very big area, because now you know that public health, primary healthcare, tertiary healthcare, everything is going to be a big need. Even upgrading your government hospitals now, which has happened willy-nilly, is also going to be a very important area. So I think healthcare investment is going to go up in India. It's always been at a very abysmal 1% level. I think finally this 2% level will come across. Now comes the other sectors. So the other sectors also have huge pain points. The malls, the retail, the whole entertainment industry. How are you going to revive them? So there we need those kind of specialized packages. So I think every sector will have its own recommendations and its own needs. And the government, and one of the things I would think is that right now our oil bill is about $64 billion. You're going to save at least half of it. Can we not use quite a large part of that towards this industry, sort of stimulus? I think we can afford it now. We couldn't have afforded it if the oil prices hadn't gone down. But with those savings, can we at least apportion $20 billion for economic revival in terms of the private sector? That's how I would put it.
I think that's a great point. And of course, aviation and tourism are going to need all the help that they can, probably the most vulnerable in addition to the sector.
I mean, basically, I think the airlines industry will have to repurpose themselves in logistics in a big way for some time.
Yeah.
And very few sort of commercial flights. I think we can also look at seeing whether hotels can become sort of, incubators. The same WeWork spaces now can be done in rooms instead of in open spaces.
Yeah. Interesting. Lots of thoughts there, Kiran. Pleasure as always. I think the good news to take away from your conversation, 2 big points. Don't stigmatize this infection. You can, if you're reasonably healthy, recover from it. Even as the research is on for antibodies production, I know you're working in that, for a vaccine and for drugs which are being researched right now for treatment. Stigmatization and therefore paranoia has to stop. Kiran Shaw, pleasure as always.
Thanks, Barkha.
Thank you.